Well, good afternoon, everyone. It is Tuesday, April 7th. It's hard to believe we've been at this now for several weeks. Joining me on a Zoom call today is our very own resident expert, Linda Opheim. Hello, Linda.
Hi, Julie. Hi, everybody.
And you're joining from the Friendship Haven campus because you live on our campus.
Yes, I've been here, well, almost 2 years in the townhome and about 4 months before that in the apartments in Kenyon Place.
A lot of people don't know how very blessed and lucky we are to have you not only as a resident, but to have you as our own infection control specialist. Will you tell me again just about your history and background?
Sure. I worked at Trinity for 43 years. I started out as a nurse's aide. That's what they were called back in the days. I worked as an LPN on a surgical floor and then as an RN. Then we opened a skilled unit and I managed that for a period of time. And then there was a bunch of stuff in between, but I will skip to the part where I did employee health and then infection prevention for a number of years. And those two go together quite well. Along with that, then of course it's easy to be on the safety committee. And then through Iowa Nurses Association, I am currently, and have been for quite a while, representing INA to Iowa Department of Public Health Preparedness Advisory Committee. And I've been on Webster County's Board of Health for quite a while as well. So all of that sort of merges together, and to me, it's all interesting. For everybody here going through it right now, maybe not so much fun, but it's interesting.
So I would think it is safe to say with your 43 years experience, you are what we would absolutely consider an expert.
I at least have been through a whole lot and I've got a lot of different thoughts on different things. And I think the key thing for me as I was thinking about getting ready for this and just even leading up to it, the work with the team on this is remembering that we all come from a different place with this. So we're all going to view it differently. And I'm probably fortunate with the background that I have and fortunate in the situation with family right now, not needing to worry about much of anybody.
Well, so. I think that's a great point. All of us are tackling this from our own personal perspective. And I think we are just blessed to have not only a resident, but a resident with your type of knowledge and expertise as a part of our plan. And a lot of people don't know, Linda, but you have been a part of Friendship Haven's preparedness since the very beginning, in our daily meetings even.
Yes, and it's been nice to be able to sit in on that. And give some viewpoints. I would say it's been really great to be working with people that have already got a good background here. Michelle's got a great infection prevention background. Other members of the team bring a lot of experience too, so it's just been fun to collaborate.
Well, and people don't know, but we didn't practice this Zoom call at all, right? So I didn't feed you anything, but in your opinion, how do you think our preparedness has gone? And would you comment just on our perseverance plan as well?
Sure. I've been really impressed with how it started out with the different stages, depending on where we were seeing COVID-19 in the country or what it would be like if it was in the state, and then what if it would be in surrounding counties, and then down to Webster County and Fort Dodge and at Friendship Haven. But the team very quickly was looking at, well, gosh, it's not in this spot yet, but I think we need to be prepared ahead of time. And so the team moved very quickly on that. And as far as listening to people's concerns and trying to take into account, how is it going to impact the employees? How is it going to impact the residents? And I do have to say, even knowing how this worked, how it spread, and what we need to do. I'm one who has always gone a lot. And right at first about being told, you live on campus, you work here, you need to stay put. I was thinking in my head, okay, so 2.5 years ago, I lived down in O Street, just not very far away, and I could come and go as I pleased. So it was a struggle. So I get how people are sort of challenged with that. With the perseverance plan, I think that was a good approach because we moved quickly from an emergency to what are we going to do ongoing? We need to have everything in place, but we need to be prepared for what comes the next day. And it isn't just, oh, we've had a tornado go through, now what are we going to do? Which Friendship Haven had years ago.
Right.
You know, what are we going to do for the long term? And so I think the move to the perseverance plan made a lot of sense to me.
I know in our emergency preparedness and in our planning, Linda, we've had a lot of conversation about personal protective equipment and planning. And how do you feel, you know, we all know that there's a shortage all across the state and across the country with PPE. We see it every night on the news. Could you speak to a little bit about how Friendship Haven plans to utilize our PPE and kind of just your thoughts on, you know, being an RN, how nurses and caregivers will protect themselves at Friendship Haven?
Sure. I think some of that, we were hearing feedback from staff anyway, but having sat in on a nurse-to-nurse call through INA last weekend, and I think even the weekend before, where it was meant for people just to call in with concerns. And another fellow member who's also an infection preventionist in the eastern part of the state, it's like, so we've spent a lot of time, as Michelle has, teaching people the right PPE to use, when to use it. And then if we have to make an adjustment, how does that make sense to the person, to the staff that are using it? And so what I would say is we've been really careful about, so we've got N95s. They are not something that we need to use right now. We're wanting to save those for later. So when we do have somebody with COVID-19, those are available. We're being very careful about, okay, if we're gonna be short on masks, what type of mask should be used and when, and trying to be consistent with a standard as far as, are the masks made the same way? Do we have a filter? I know Michelle and I sometimes are giving advice or asking questions, and it's always going back to, okay, what's the standard? Has CDC or Iowa Department of Public Health changed the standard from what is normal? So we're trying to keep to those standards because it's most important to make sure that we're keeping staff and that we're keeping the residents safe. So as things change, I guess the other thing I would mention too is we like to know what we're going to do and that this is how we do it and we go forward. Anytime we have something totally different like COVID-19, we learn a little bit in the beginning. And then as they deal with it more, it's like, oh, okay, so yeah, it's droplet and it's airborne. It's sort of like H1N1, where if you're doing aerosolizing procedures, you definitely need to have the N95. And so the more we learn about the disease, it's not that we're just going willy-nilly. It's like, we're going to address what we know about it right now.
Right, right.
And I know the other big piece with the PPE is making sure that even though we've all been taught, I know people as they come on board have been taught the bloodborne pathogen precautions and how to put on and take off personal protective equipment. But if you're not using it a lot, it's really easy to get lax, and then you can infect yourself or contaminate yourself. So I know that's been reviewed with people as well.
And in your experience, Linda, you know, you've had this just great career and lots of experience with infectious diseases. You know, what advice and reassurance would you give our nurses and caregivers, not only now, you know, we don't have it in our building now, but should we get it in our building? You know, in your past, you know, you offer some great advice. What would you say to our workers kind of on the front line here?
Yeah, I've thought about it, you know, thinking about HIV and AIDS, and then thinking about H1N1. In employee health, I dealt with pertussis and hepatitis A, different things along those lines. And what came to mind this morning was, if you meet fear with knowledge and preparation, then it should help make that manageable. And if we can look at, how we know it's spread and what we have available to us to take care of those patients. I think I shared the other day about back when we first were aware of HIV, and even though standard precautions, originally it was universal precautions, have been put into place. Back in the olden days, we had Cardexes where you figure out what you're going to do each day with different patients, and people were still writing and read HIV. And so, I was a staff nurse at the time, and it was like, hey guys, what are we doing with this? Because we're supposed to assume everybody has it. And we're sort of in that place right now with COVID, as far as what we're doing as in general as public about it. Let's assume someone has it. So let's do the distancing at work. Let's make sure that we're using the PPE. I know with pertussis cases, it wasn't uncommon for me to, when I found out we had a patient with pertussis, and then you go back and do the follow-up, which is what public health is doing right now with COVID, find out, okay, who all took care of that person, who had contact in that time frame, and then a bunch of questions, but part of it would be, okay, were they coughing? Well, yeah. So you had a mask on? Well, no. And so then at that point, it's like, okay, so you're going to get some medication. But part of it is, let's review what's part of standard precautions. So if there's somebody coughing in your face, you can't get far enough away. You should have a mask on anyway. So some of these different things sort of repeat themselves, and it's just part of being responsible to do what you've been taught. And the other thing is, it's much easier to do the right thing if we've been given the why. And what I've seen from the team so far is that they've been pretty careful about trying to let employees know the why behind what we're doing. And I would just say to any employee, if you've not heard the why, or if the why doesn't make sense, ask again directly, so that you get a good answer to that in a timely manner, rather than about it.
And we've created avenues for employees to do that. So I just want to make sure I got that. You said something earlier, Linda, that was just great. We meet fear with knowledge and preparation.
Yes. Yeah,
that's great.
To me, I think that's the best way to at least control what fear that might be.
So Linda, you're our nurse in adult day from on a regular basis. But since COVID-19, you have certainly been an elevated member of our team, and we are blessed to have you on our team. We are glad you are a resident with this great knowledge base, and we're so lucky to have tapped in to your expertise. I just want to, on behalf of the team and all the residents, thank you for your expertise, wisdom, being a great part of the team, and also representing residents as a Tom Home resident. So thanks so much, Linda. We really appreciate it.
You're welcome. Thank you for the opportunity.